Okay, good morning, everyone. My name is Lance Beck. I'm President and CEO of the Greater Spokane Valley Chamber of Commerce. Pleased to have you joining us again today for our weekly Joint Chamber Small Business Resource Call. Our partners at GSI and West Plains Chamber of Commerce, on behalf of them, I want to thank you for joining us on this weekly call. Today, we're excited to hear an update from Dr. Bob Lutz with Spokane Regional Health District, as well as some updates from AWB, and then hearing from a couple of our local business partners here. And so thank you to our speakers, Dr. Bob Lutz, Tommy Gantz from AWB, Jeff Phillips from Rosauers Supermarkets, and Clinton Slovarp from Walmart. I'm confident most of us are familiar with the technology, so I just want to give you a few reminders. We do ask that you keep your mic muted throughout the call to help everyone hear the speakers clearly. We do have the chat box open. If you'd like to submit a question for our speakers, we'll do our best to get through all of those on the call. Our team at the Valley Chamber is committed to following up with any questions that don't receive a direct answer here on the call today. You can also send us follow-up questions to info@SpokaneValleyChamber.org. Our staff will post that there in the chat box here momentarily for you to utilize. So if you do think of something following the call, rest assured we'll get you an answer to your question. At this time, I'd like to go ahead and invite Dr. Bob Lutz to unmute, and we'll start off with an update from the Health District.
Well, good morning, Lance. And everybody can hear me, hopefully, yes?
Yes, we can.
Great, thank you. Well, thanks for the invitation, and I appreciate that. I will keep my remarks kind of brief because I'm sure people have lots of questions. Certainly, as you know, the last couple of weeks has been sort of very interesting from the standpoint of being in this state of wanting to move towards phase 2, wondering what the guidance will be, whether or not a variance request will get granted, and then ensuring that businesses are comfortable with opening up. You may have heard, if not, then you will hear very quickly that that variance was denied at the state level, which means that Spokane County will not be opening in an earlier date than May 31st, if all the metrics are met at that point. So again, I think that gives us time. One of my concerns has been in conversations with business owners that given guidance that we've been now seeing coming out from the governor's office and from the Department of Health around expectations going forward, it may be challenging for businesses to be able to meet those criteria and recommendations in a very short time frame. So I think this does give us an opportunity to ensure that you as business leaders, as business owners, can make the healthy choice, the easy choice for customers coming back in, so that they understand that you have done everything you can to mitigate risk for them coming back into those businesses. One of the issues that has come up, and I'd love to have feedback from you, is that as is going to take place in Seattle on Monday, essentially individuals who are out and about going into social spaces where physical distancing is going to be challenging are going to be asked very strongly to wear masks. The evidence is good that if I wear a mask, I protect you. If you wear a mask, you protect me. Collectively, we protect each other. And therefore, opening is going to be predicated on not having significant outbreaks. And if there are simple things that you can be doing as an individual to prevent those outbreaks from occurring, then I would hope that people are willing to take that on. But again, I think it's going to be a new norm. And it's going to have to be, in my opinion, a norm that's really strongly encouraged by businesses. And so I'm just kind of curious to get a pulse check on whether or not business owners such as yourselves think that such a declaration would be received, acknowledging that it won't be well received by all, but at least received in a fashion that, again, makes your business one of those that's making the healthy choice, the easy choice. And then I would just also say that one of the documents that we at the Health District have put together, and hopefully we'll have it finalized soon, is sort of a checklist that as you're looking at the guidance documents coming out for your respective businesses, you could be going through that checklist to ensure that here are some things that we need to do that we've met, And if we can't meet, maybe how we can go about trying to address them before we open safely. So I'll leave my comments at that point.
Okay, thank you, Dr. Lutz. I know we're working on a poll question here to go ahead and get some feedback here live during the call. We'll move into some questions while individuals take part in that poll. One directed towards you here was, if you could explain the position you took on supporting the mayor's and county commissioners' push to accelerate the city's opening, and why you felt it was safe for Spokane County to ask for that variance.
Yeah, certainly, Lance. You know, there were metrics that were provided by the Department of Health and the governor's office a couple of weeks ago for counties less than 75,000, and they needed to have essentially no cases, no confirmed cases in 3 weeks. We're not a county less than 75,000, nor would we have met that bar. That said, if you looked at the governor's document, you saw that there are metrics in the dashboard that are ones that we in public health are going to be looking at going forward to see whether or not communities are truly safe moving forward. So I just looked at those metrics and said, do we meet those metric requirements? Number of hospitalizations, number of cases on a daily basis, outbreaks, hospital capacity. And looking at all those documents and looking at all those data, I said, yes, at this point in time, we have met those metrics. And therefore, in the current state, I felt as if we were in a good position to ask for variance, knowing, however, that no variance criteria had been established for counties of our size. So at the point in time, given what I knew about our current status around COVID-19, I felt that we were in a good place. And I could say the same thing at this point today. I think we're in a good place. The caveat and the caution that I provide is that as we open up, we need to be opening up very cautiously. And I want to be able to do that in a fashion such that people are doing the right thing, businesses are supporting customers, doing the right thing, and collectively, we're all doing the right thing, working towards a opening more so as we go down through the summer. But again, at the time, I felt we were in a good place.
Okay, and again, if everyone on the line, if you can take part in the poll to help us get some feedback here live on the line for Dr. Lutz, that would be great. We'll leave that open for just another minute here, and then we'll share the results of that. Dr. Lutz, another question was, for a small professional office, what specific precautions would you recommend as they take to reopen their doors to clients within the phase 2?
So with respect to small spaces, I think going forward, irrespective of the phase, there is always going to be a requirement going forward for physical distancing as much as possible. I think the masks are one of those situations that, again, sort of allows you to get around the physical distancing. And so mask of both customer and staff, I think, is going to be an important part of opening. Any space is going to be asked to really emphasize as much of the sanitary hygiene, efforts as possible. So frequently touched is frequently cleaned. And I've been very impressed when I go to different stores around the community that, again, I see shopping carts. I see different things that are being cleaned frequently. That's going to be an expectation. So if you are a small business and you have somebody coming in for professional services, the expectation is that, that person coming in, if you're close, if you can't get that physical distancing possible when you're doing that interaction, that masking is going to be strongly encouraged. Anything that's touched frequently is going to be cleaned often, and you're going to be doing things along those lines.
Okay, and then a follow-up question within the restaurant sector. One of the notes that's been out there on the state newswire here is the requirement for contact tracing and the element of needing to leave a name, phone number, email address as you go places. Can you give some insight onto why that would be necessary?
Yes, restaurants are one of those sort of interesting venues from the standpoint of, if masking is going to be sort of a new norm for us, and you're going into a restaurant, you're obviously going to be taking off the mask when you're eating and drinking. Restaurants are going to be doing all they can to ensure that physical distancing between tables, but there are still going to be times where people are going to be in close proximity. And so restaurants are also one of those situations where it's not uncommon for people to be able to give their name for a reservation. We want to be able to, as we have cases that develop, we want to be able to do the case and contact tracing and investigation. And having that piece of information is really helpful. So you may be in a restaurant, you may unfortunately come in contact with someone who is asymptomatic, who unfortunately infects you, and then you get symptoms a week later. You present, you get tested, and you're testing positive. Some of our epidemiologists are going to be reaching out to you to find out where you could have become infected. And knowing that you were in a restaurant a few days prior to the onset of symptoms gives us a start, because then we're going to be looking for other people who could likewise be infected. Restaurants are one of those venues, as I've mentioned, where as much as you try to ensure physical distancing, it's not going to be able to happen all the time.
Okay, and then if a company would like to test their employees for COVID-19 or the antibody prior to coming back to work, who would be the ordering physician in that case? If the company pays for the testing and has the employee sign a waiver, would the ordering physician requirement be a moot point?
Yeah, it's a great question, and I think that is still trying to be worked out. I know there was a task force from Greater Spokane Incorporated that's looking at the whole testing strategy and testing for businesses. So if a business has, for example, a third-party vendor that's going to provide this service, then they would just contract with that third-party provider to have the testing done and have the results called back to them. And to the best of my knowledge, no physicians from the business standpoint would be involved. Rather, it would be the business, I should say, the physician or practitioner from the third-party vendor.
Okay, and then one question that came in was, is it possible to estimate the percent of how many people in Spokane County might fall into that category of COVID-19 vulnerable populations?
Yeah, that's, if you look at the definition of vulnerable, it's essentially individuals over the age of 65, individuals who have a variety of medical problems, people of color. There's a huge list of individuals who meet those criteria. And so it's really difficult to get a percentage of those individuals, if you will. That's just information that I think would be very, very difficult to obtain.
Okay, and then circling back, the notion on the masks being a pending recommendation that looks very likely. If a business has plexiglass and 6-foot distancing, would masks still be necessary in that instance?
No, I think again, that's what I've seen, for example, going to some grocery stores where you've got the plexiglass screen between the cashier and the shopper. I think that's adequate. But again, as it depends upon the whole situation, but having a plexiglass screen between and that 6 foot of separation, I think would be adequate.
Okay, and then we're going to let you, we're going to give you a break here with kind of one final question, though, that I know you made the note earlier in the call that we have received the governor's response. Knowing your schedule this morning, I'd imagine reading through that response with the fact that you've been on back-to-back calls now probably hasn't fully taken place. And so do you have any insight into what their reasoning for the denial for Spokane County was yet? Or is that all, you still need time to digest what you got back?
I think it really comes down, Lance, to the fact that there were no criteria established for counties of our size to determine a variance. And so I think, as I mentioned earlier, I looked at the metrics that are in the governor's document. Are those the metrics that are going to be asked of counties seeking a variance? I don't know. And so my belief is that Dr. Weisman from the Department of Health, acknowledging that there is no variance process for counties of our size, said, at this point, we're not going to grant a variance going forward.
Okay, and final piece, we had the last question regarding contact tracing. outside of the restaurant industry, what your viewpoint of what we're likely to see moving forward on the front of contact tracing.
I'm sorry, run that by me again, Lance. I got distracted. Apologies.
So contact tracing and aside from the restaurant industry, what are we likely to see as far as the county's position on how their approach will be for contact tracing in other industries?
Yeah, I mean, it's not necessarily going to be industry specific. You know, it's going to be literally as we are made aware of specific cases, irrespective of where that individual works, we're going to be doing the investigation that we typically do for any notifiable communicable disease, be it COVID-19, be it pertussis in kids in school settings, be it measles, what have you. The process is pretty much the same. It's just, as I mentioned, that in some of the guidance around restaurants, the ask is that restaurants keep that information. But otherwise, there's not going to be, to the best of my knowledge, any requirement that, nowhere I think is it feasible to get that kind of information, contact information for every customer that comes through the front door.
Okay. I wanted to touch base. I know you've been working on a checklist for business safe reopening here, and I'm excited to be able to share that with obviously the business owners that are members of all of our groups here and have been tuning in. I know that you were working hard on that through the evening last night, and I'm not sure if it's quite ready, but are we? When could we expect to be able to share that guidance with our community here?
And my hope is to be able to, I was going to send that to Kara at GSI as my first point of contact and have her take a look at it. And then if there's any feedback that she or maybe others at your chamber would be able to provide for her, for me, and then hopefully get that finalized, by close of business tomorrow.
Okay, awesome. So again, another piece and another tool for business owners to be able to utilize to begin preparing. Nice to have that develop locally and be able to have it coming out. And then I did want to address one final piece. I've said that a few times. They keep coming in. We think it would be important to clarify. So the denial for the variance does come from the Department of Health and Secretary Wiseman, not the governor. Is that correct?
So so the process is that it gets submitted to the Department of Health, and Secretary Wiseman, as the Secretary of Health, he makes then recommendations to the governor as to whether or not the governor should grant the variance. So the documents that we forwarded, as were done by other counties who were seeking variance, it goes to Secretary Wiseman. He reviews it, looks at the data, makes the recommendation to the governor, and then the governor grants the variance.
Gotcha. Okay. Well, again, we appreciate you carving out some time for us here this morning and being able to provide some clarity on those guidances coming down. If you're able to stay on the line and we have additional questions at the end, we'd appreciate that. If you need to go, we understand, and we'll just direct those and get direct follow-up out. But again, thank you very much for joining us, and thank you for all the hard effort to keep the details straight and keep us in line for the path to recovery. I know right now it looks like May 31st is our target date for being able to enter into that phase 2. And so there's a lot of work to put these precautions in place and be able to safely open. And so a little bit of time now, unfortunately, with the decision for not being able to move the county along, but we now know a date that's in front of us for the next set there. So thank you again.
My pleasure. Thank you. Have a good day.
Thank you. Next up, we have Tommy Gantz, Government Affairs Director, Tax and Fiscal Policy from the Association of Washington Business with us. Tommy, if you're able to unmute and if you have video, we'd love to see you this morning. And we'd like to hear what AWB has been working on when it comes to the PPE, both sourcing and distribution process that you've got lined up. So we'll welcome you to the line.
Sounds great. It's nice to be here. Can you hear me okay?
We can.
Excellent. I'm just going to change my background so you don't see my messy craft room here. Can I share my screen?
Can hear you fine.
Yes, let me give me just a second. And there you go. Go ahead.
Okay, let's see here. So I have just a quick little presentation. It's only about 4 slides. So initially when I got started in this, we were asked by the Department of Commerce to come and support their efforts in the governor's call to action for manufacturers. We didn't initially really understand what our role was going to be, but as we've moved through the process, we understand that what they needed from us was to be their messaging piece on having manufacturers follow the state's process. As we went through this, we also discovered that they were really looking for larger manufacturers who had large manufacturing capacity to retool or the capability to jump right into manufacturing. They really needed companies that could compete with Asia pricing. And so that left a lot of the smaller manufacturers without resources to move the product that they had taken time and energy to go out and retool or start manufacturing masks, gowns, all sorts of various PPE. So we at AWB said, what can we do to help these manufacturers? And I'll talk a little bit more about that. I guess the Tuesday call is going to be more focused on the manufacturing side. So I'll save that for the Tuesday call. But the conversation has evolved from how do we manufacture PPE to businesses that are reopening, needing to understand what are the requirements for reopening, what do businesses need to do to prepare, and more importantly, how can we get PPE? There's a lot of challenges right now with shipping from Asia. There's a huge drive and demand to support our local economy, to support our local manufacturers. And so people are really preferring to buy from our local manufacturers as possible. So as AWB went through, we discovered that we needed to do something about this. So we started something called the Rebound and Recovery Task Force. Right now we have an AWB, I can share some links with Lance to share with the group a little bit later. But we have a website that has plans for reopening, some legislation of note, tools for businesses, and some human resource considerations. But it's not the most user-friendly, and it's really not what the businesses need. So we went through and created 2 sub-task forces. The first one was a business reopening toolkit task force, and the other was a PPE task force. The business toolkit task force went through and we reviewed a multitude of organizations that had submitted their business reopening plans for review, their best practices, what they were doing, and then we looked at other states' plans. And we really liked something similar to the Pennsylvania model. It's a very user-friendly interface. It gives you really all the tools that you need to understand what your business needs to do. And so we're trying to develop that. We've reserved 2 domains. We've reserved reboundandrecovery.org and reboundandrecovery.com. We haven't decided which one we're using. It's all still in development. And some of the tools we hope to have on there are generic templates for the smaller businesses that don't have the staff or the resources to go out and hire a PR firm to help them do this. So some of it will be like visitor logs with COVID-19 related questions so that you can save it for your records. And you could just put your company name and your logo in there. So I think it's going to be a really great tool. We expect to have that up and running hopefully by end of next week. Or the following week. And then we also have the other task force, which is the PPE task force. And what we have done is developed a web-based solution to the PPE crisis here in our state. We've been sending out surveys to all of our manufacturers, and we've shared it with PNAA, AFA, GSI, with Spokane Valley Chamber. Some of you, if you're manufacturers, may have gotten the survey. And they're sort of generic supply chain questions. How many RFQs can you handle in a day? What's your capacity? What's your MOQ? Who's your contact? And so this web-based solution that we have developed, I'm terrible about forwarding my slides, sorry about that, is going to have, it's going to be like a lending tree style model. If any of you are familiar with lending tree, what it's going to do is it's going to be quick and easy, and it's going to be just a connectivity service. So you'll go on there and you'll click. Here I can show you a sample of this. This is what the interface looks like. It's still under testing and development. But you'll put your name, your business name, your email, your phone number, And then I know that for the Spokane Valley area, it's really important to look really even closer than just Washington State. Some of you want to support your local city businesses. So we've got your zip code information so that the first people that will pop up are people that are the closest to you. And you're going to select the type of PPE that you need. And what it's going to do is send an RFQ to everyone that we know in that general vicinity that has the type of PPE that you're looking for. The submitter will get a list of companies that their RFQ has gone to with the contact information. And then the companies that are receiving the contact info or the RFQ will basically the onus will be on them to reply to the RFQs. And again, it will be based on some of the questions that are answered in the supply chain survey that we've sent out. And so that's really the things that we have been working on. We have a lot of resources that are great for manufacturers too, but like I said, I'll save that for next Tuesday's call. I'm happy to take any questions. I didn't really have a whole lot in the way of presentation.
Thank you, Tommy. And again, Tommy's referenced the call next Tuesday. We have just formalized a manufacturing focused call with Impact Washington on a lot of details for pivoting your manufacturing business and bringing PPE production online, and then finding tools to be able to get that production out into the marketplace. And so we will be sending a link. Everyone that's registered for this call will get that link for the option to register there. It is a manufacturing specific call that will take place Tuesday at 11, focused on getting that information out from Impact Washington to our local manufacturers here. And then the portal, Tommy, can you share in regards to kind of timing for when the portal on your guys' end is going to be likely available and online?
Yeah, so the surveys, we started sending those out on Friday. Again, Lance, if you didn't get that from me, let me know and I'll get that to you so you can get that out to your membership. Once we get the approval, we have a call today later with our leadership to get approval to move forward. It'll take about a week for the testing and development to complete. So we're hoping to have it up and functional by end of next week. The more suppliers we have registered, the better. Right now we have, I think, close to 35, 40 suppliers listed on there. And I expect to see more and more and more. I know that about 500 suppliers registered with the Department of Commerce. So the focus again is to keep this on Washington State. So it is going to be available to non-members. I see a question in the chat. It's going to be available to anyone that is a business owner that's looking for PPE. And the goal, like I said, is to have Washington State manufacturers there. And we know that there may be some gaps. There may be some PPE product that you can't get here in Washington. So we are having conversations with Oregon and Idaho. We have several businesses in Washington that have manufacturing operations in those areas. So we're looking to our sister states to fill those gaps. We still want to keep it local. We want to keep it in the Pacific Northwest, but we haven't gotten that far with it. We understand this is going to be an evolutionary process. Right now, our main focus is just getting it up and functional and working through any of the kinks that arise as happens with any new product. And then from there, we can evolve. We know that people are going to be asking for additional features as we go as well.
Another question came through on, will the portal also have testing and those type of supplies linked into there?
We haven't gotten that far. At this point, what we have are face masks that are disposable, rated masks like the KN95 and the FFP2 filter mask. We may have N95 masks up there. We know that there's some issues. I've had a lot of calls from agriculture people who say that LNI has a requirement for us to have an N95 mask, but we can't get them because they're being saved for the medical community. So I've reached out to LNI with some questions for them to provide their guidance on that sort of thing. And as soon as I have a response, we're going to have that sort of information included. Face shields, hand sanitizer, ear guards, thermal scanners, face masks that are cloth, plastic gowns, sneeze guards, sanitizing wipes, thermometers, and eye protection. We also have, I'm working on getting some custom fabrication there. I'm getting a lot of calls for custom sneeze guards, especially for transport vehicles or custom flex work. So we're going to try and get that in there. And as we go through and more suppliers make themselves available, that will allow us to expand the diversity of the product that we offer. We would also like to see the services sector move in there. So if you need COVID-19 related testing, that sort of thing, then getting to that, but we haven't gotten there yet. And I have seen that PPE exchange for FEMA. It's pretty rough and dirty. We didn't model it on that because it's more like a dashboard where one person on the left-hand side says, I need PPE. The person on the right-hand side says, I have PPE, and they're just throwing their names out there, their product. It's not really searchable. At the end of each week, everything disappears and you have to go and resubmit. Amazon also has a PPE website. A lot of their product is from Asia, which is great if you can get it. But right now, some of the challenges with Asia are the shipping. Right now, the carriers don't want to ship smaller packages. They're only looking at container size shipping because the volume of shipping has gone up so much. China has increased their regulations of what they can ship and how many they can ship. I know for the 3-ply disposable surgical mask, the shipment can only contain 500 masks at a time. The shipping costs as much as the product, and it has to come with the certification. So it's a real problem for everyone right now. The manufacturers will not be vetted. We are not endorsing any of the manufacturers. These are just local manufacturers that we have worked with. They're either members of ours or members of our sister organizations that we know that are making the product. I would assume that Washington State manufacturer would not want to price gouge, but if you're looking for prices like what you're going to find in Asia, I think it'll be highly unlikely that you'll see that. We simply don't have the capability in our current supply chain because the source materials are simply more expensive here. So like I said, we don't endorse them, and we're not, obviously I think if we see something going wrong or we get complaints, we'll look into that, but this is not this is just a matchmaking service is what it is.
And I think that's a pretty common sense reality behind a manufacturer that's pivoted their entire production line to create a new product and having to source the raw material to do so. Likely it won't be those same prices, but the goal is that the more that we can do locally, the more availability we'll have, and the market will reset at a new price there. So thank you for your time. I know there may be more questions coming in here, so if you're able to hang on to the line and
Sure.
just follow the chat box there, we'd be appreciated for that. And then again, next Tuesday, 11 to noon, we do have a manufacturing focus call. Impact Washington, Tommy will be on there as well to answer questions and again provide some more guidance on those manufacturers looking to pivot and get into the PPE production, as well as finding a market to sell theirs. So Tommy, thank you again for joining us. We're going to shift over to Jeff Phillips, who graciously agreed in the midst of a bunch of travel today to find a place with secure internet and jump on the call. So Jeff, thank you for joining us. If you want to unmute, we'd love to hear more on how Rosauers has been operating, and you've been one of the early adapters for utilizing the precautions with the PPE. So both from an employee stance, how you've gotten your staff on board, as well as what you've seen potentially just kind of high level from your customer interactions and how they're reacting to it.
Great. Yeah, thanks, Lance. I'm actually coming to you from sunny, or maybe not so sunny, Ellensburg, Washington. And by the way, it's a ghost town here. As a university town, there's nobody here. Just a quick intro here, I guess. First of all, I just want to say that the key to the success of any essential business or later non-essential business opening and being successful is really to gain the confidence of the consumer. And they need to know that you are taking care of them in every which way you can to make sure that they are safe. And that also goes for our employees as well. We wanted to make our PPE and all the activities that we're doing around cleaning and sanitation as visible as possible, because I think that helps a consumer understand what your commitment is to that whole process. And so we've been doing those things right from the very beginning. I think most of us have plans that are sitting on a shelf that talk about emergency preparedness and maybe even have a little bit of pandemic stuff in them. What we found in our plan was that it was a lot of very high level concepts and very short on details. So I can assure you that we now have a pretty detailed plan going forward with this particular pandemic and anyone that follows after this. So with regard to PP&E, we really started out as quickly as possible, but had some missteps, if you will. And I don't want to say necessarily missteps on our part, but we were following the CDC guidelines from the very beginning. And early on, they were saying that masks really were only necessary for emergency responders, the medical community, and if you were sick. And so we had a number of people who had contacted us about purchasing masks. And we kept sending those people off to our first responders to the hospital systems. They were all N95 requests that we were getting, or solicitations that we were getting. So when it came time for us to need the masks, when the CDC sort of changed their position to recommend masks in public places, then we were on the scramble. And just as Tommy said in a few minutes ago, what we found is that the deadlines, because everybody was now looking for masks, those deadlines for delivery were being pushed out 2-3 weeks. And so, and to the other point made, vendors were trying to gouge and get whatever they could for masks. So I really appreciate that the chambers are coming together to try and create a hub for distribution of PPE. It's really critical that our small businesses particularly have a source for that that's reliable and affordable. So thanks to all of you guys who are working on those things. So with regard to the rest of the PPE, we started out with within the cleaning protocols, making sure that we had all of those things straight. Dr. Lutz made a comment that I thought was really appropriate, which is, you know, I protect you, you protect me with regard to the masks, but it also, he said something about frequently touched, frequently cleaned. And so that was our focus early on, just to make sure that we were doing everything that we possibly could to make sure that customers saw firsthand that we were really doing everything that we could. And that included having somebody stationed in the lobbies of our stores, actually physically wiping down the carts for each individual shopper as they came in the door. Lots of very positive response from that. And I would highly recommend that as businesses get ready to open, they think about that visibility of those particular PPE and cleaning and sanitation regimens, just to make sure that people understand your commitment to keeping them safe. And so we installed a lot of that. We saw somebody back on the East Coast that had developed a shield at the check stands. And so we got on that right away. We found a local supplier with plexiglass that was able to cut all that product for us. And we had all of our stores, 22 stores across our chain, outfitted with plexiglass shields at the check stands in less than a week, which was just a monumental task, but one that we were able to accomplish. And part of that was because we had local support and didn't have to go out looking for that. When it finally came to the point about masks, again, we did find somebody local. We used an upholstery shop that had converted some of their workload into mask making. And we want to support local as much as we possibly can. So we went out to that vendor and they were able to produce the first go around. They quickly became overwhelmed. And so we did have to end up buying some masks from outside of the marketplace, but our first initial shot came from local. One of the things I will say about masks is that, you know, we had a number of employees push back on the whole mask thing. And so we tried to make mask wearing as, let's say, as easy as possible. Let's just say that we gave people options. So in addition to the cloth masks that we provided, we also provided face shields, and we allowed bandanas to be worn in our stores. We had several people that pushed back because of claustrophobia. We had several provide a doctor's note that said they couldn't, you know, be confined by a mask. And so again, we made arrangements to make other options available to all of our employees so that we could accommodate them. Through this whole thing, our really mantra has been full paychecks for every one of our employees. And so we've done everything that we can to make sure that we're accommodating people as much as we possibly can. The barriers themselves, I think, were a big hit. We had a lot of very positive feedback from customers saying, thank you for putting up that extra piece of protection between me and your employee. It protects me and it protects your employee from me. And so we put those at all of our service counters and also at our check stands. And then came social distancing. And so we really, at the beginning, of course, didn't have access to the fancy decals right away. So we just took tape and placed those X's on the floors in all of our high congestion areas, and asked people through signing up and down every aisle and at the front doors to make sure that they were socially distancing. So I sort of throw that in with the PPE thing because it really does help with the whole reopening process of social distancing, as well as the masks that were out there. So with regard to some of the other things that we're doing inside the stores, we did provide for special times for at-risk people to come inside the store. That was sort of an interesting deal. The first couple of days that we had our at-risk and senior hour shopping, it was like a old home week for seniors. People were embracing each other and shaking their hands, and we were out on the street saying, wait, this, you need social distance, and all of these kinds of things. And it didn't take long for people to kind of figure that out and kind of get into a routine there. But I think that was one of the things early on that was sort of a bit of a surprise to us for a population that was really asking for these special time frames, that they really weren't prepared to really deal with the social distancing behaviors that really were necessary there. Let's see, I'm trying to think. With regard to customer and mask, and I know that your survey's been up, we've already had a fair number of customers either write through our website or send us notes through other means asking us, when are we going to require all customers to wear masks in addition to all employees? And that's been a sort of a pushback both ways. We have people saying, never going to happen for me. I'm never going to wear a mask in your store. The minute you do, I'm never going to shop you again. And we've had just the opposite, which is as part of your commitment to the community, we appreciate you considering masks for all employees as well as customers. And I know that there have been other retailers, Costco being one of those, that is requiring all shoppers in Costco stores to wear masks. And I think one of the things that is sort of going on in dialogue within our organization is, if we all do our part now, if we all accept the mask thing as something that we have to do in order to push us down the path toward reopening the economy, then we're willing to sacrifice doing that up front to know that we're all going to be in a better position later on. So that's a little bit of some of the pushback and acceptance of PPE for us.
Awesome. Thanks, Jeff. And thank you again for taking the time and making your momentary pause there in Ellensburg to be able to jump on the call. I know really helpful to hear reaction from an organization that's been doing it from the very beginning here. And you've really been able to test different strategies. And so we appreciate your insight and sharing that with us here today. Sure. We're going to pivot over to Clinton Slovarp with Walmart, a little different perspective from a national brand here, and hearing how they've rolled out their measures here. So Clinton, if you're able to unmute and join us, we'd love to hear from you as well.
Absolutely. I think Jeff absolutely did a fantastic job with Rosauers. The things they were rolling out, we were doing very similar. And for the sake of everybody's time, I won't repeat some of those same measures with masks and tape on the floor and otherwise, but the sneeze guards on the registers, the masks for associates, the social distancing decals are all really key pieces of what we did. I'll kind of break this out in just some of the associate-facing measures we've taken and the customer-facing measures. And I'll try to spend as much time on the pushback or problems you might see as you roll these out more than the actual measures. But one of the things we do at the store, it took us a couple weeks to get there, and it was really just with sourcing, but we do screen all of our associates. We've implemented a separate entrance for associates from customers. Part of that is to allow us with screening to keep them separate from anyone else if there is an issue. And basically that screening is evolved several times. It's basically reduced to, do you have any of the hallmark symptoms of coronavirus? And we rattle off this list of the fever, chills, muscle aches, loss of taste or smell. I could almost repeat it to you because I do it a couple times a day. And then it ends with, hey, do you have any symptoms that are new in the last 14 days you took medicine to resolve? If you get a no to either of those questions, we send you to a second station where we talk about, getting people sent home. And for us, fortunately, if we have to send someone home for that, we do send people home paid, but basically they can't come back to work until they've had what the CDC recommends, that window of 3 days without those symptoms. We also do a temperature check. Anyone that pops above 100, we are going to also send home until they've been fever-free. as recommended by the CDC. So that's something we've implemented that keeps us from bringing someone who wants to come to work sick. We can catch that and make sure that they're not coming into the building. At that point, at the associate screening, some of the challenges you might see with the forehead thermometer, if you've been standing in the cold, it's 40 degrees, you're going to come in and read 97. I've been told I'm 97 a bunch of times. You do have to acclimate to indoor temperature for a minute for that to be effective. We have been requiring all of our associates to wear masks at the associate screening. We do offer them a mask and gloves. If they want gloves, those are optional, but a mask at the screening. And then we do give the option for the associates to bring their own face covering. We're pretty liberal to what that can mean. We really just want to make sure the nose and mouth is covered. And they're using some sort of cloth or face covering. So we've seen bandanas. There's some women's headbands that look kind of like neck gaiters that are really popular with the associates, or they've made their own. And we do allow that as an alternative. Break rooms and associate areas. It's been a really big challenge. Just because you're off the sales floor, we think we can congregate. So a lot of effort put into less chairs in the break rooms, spacing out all your associate areas throughout the business to make sure they can congregate. Won't go into details, but we put a lot of effort on being a larger chain into our leave and attendance policy. Very forgiving right now. People who don't want to come to work, we're not punishing them for not coming to work. And so that'll have to be decided on a business by business case. One of the catchphrases we use a lot is 6, 20, 100. So for our associates, we like to ask them regularly what that means. 6 is for 6 feet apart. 20 is for 20 seconds of washing your hands. And 100 is don't be around people if your temperature is over 100. So something we really emphasize with our associates, kind of teach and train them to maintain that and model that. And as I move to some of the customer facing measures we've taken, I think it's important to know anything that you try to ask your customers to do, because you can mandate employees to follow protocols and policies. You can't truly police your customers. You can politely ask them to do things, but you can't force your customers to do things. And so that's going to be something we talk about that's difficult to navigate. But if your associates don't model the behavior you're politely asking for, you're never going to get a customer to do it. So that's where we put a lot of effort on that. And then obviously throughout your business where you can, we focus on making things fantastic. So that would be, any sort of credit card payment. Hey, we'll sign for it. To anytime we can hand off a tray and just our various services, we do that to limit the touching. Some of the pushback with associates, some associates felt like it violated their privacy to have to answer those screening questions. That associate bring a lawyer to a store to ask why we're making them do it. You're going to see a lot of pushback on the masks. And it's a comfort thing. I got this one here. It's what we hand out. I've got different ones I've used. We have associates that have to unload a truck. So if you can imagine being on a 53-foot trailer, you're basically going on a jog with weights. You're throwing boxes, really uncomfortable. And so you're going to have to really keep in mind, it's going to have to be subbing people out that are in any sort of heavy labor situations, more breaks, a space for them to go where they can go take that breath, or maybe take additional rest breaks, because it's just super uncomfortable. I've got a beard. I tell you what, I've come close to shaving it off several times. And those are some of the inconveniences with it. And then obviously Jeff mentioned some of the medical accommodations that come through. That's been a challenge for us. What we've eventually put in place is we've acquired face shields. So for an associate with a true medical accommodation, we've been allowing them to wear a face shield in lieu of a face mask. And then of course, just explaining to other associates, hey, they have a medical reason, that's why. Otherwise, the associates have been really good about it. The most difficult thing of all the measures is keeping them apart in the break room. They really want to socialize. That's been the biggest challenge. But customer facing, some measures we've taken there, we are metering at our doors full time. So regardless of how many people are at the building, the goal is to have someone there to space people out. It's easy to forget when you're on your errand. So something we've been doing, it kind of sets the tone right off the bat. You can have someone who's doing that metering and talking to people. As they come in, you can cover some of the things you have going on. Hey, we're social distancing. We have directional shopping on the floor. Keep an eye out on that. And you're kind of priming for the customer that there's these new expectations. We do have capacity limits in our building, something that probably has to be considered for any business that reopens. I think we were shooting for something like, I think it was 5 or 6 people per 1,000 square feet. We have the luxury of being, 250,000 square foot buildings. But you're gonna have to kind of think about, if we're 6, 8 feet apart, what does that look like? We actually, in my area, we dropped that a lot lower than the company expectation. It's just based off of what felt right and safe, So most of my stores are between 300 and 450 people. That's way less than the 5 per 1,000 square feet, but depending on if everybody's just in grocery, spacing that out, something to consider. Social distancing does play over our speakers throughout the day. It messages a great recorded message of our expectations, things to consider, just to remind the customers while they're there. We do have all the social distancing signing. Pretty much all of our price point signing now has signs to remind people. It's just all over everywhere, just to remind people that that's our goal. And then we do have the arrows for directional shopping, controlling which direction you go up and down the aisle. We've done some things where we've reduced our hours. We've limited entry points so that we can control entry and exit to try to separate people. And when it comes to the customer piece, you've got to have everyone on your team that's an associate model the expectation. There's a lot of pushback there. Then you really have to focus on doing a really good job politely requesting, politely reminding of some of these expectations of directional shopping and social distancing. And 90% of people are very respectful of it. There's 10% that won't be. But I think that's been the most effective. A lot of pushback from customers. Anytime you do something new, obviously, they're mad that, one door is an out only and not an in, or they're mad that you want to tell them which direction to shop, or, whatever various things there are there. And so you'll be faced with some tough decisions as there's customers that don't want to follow the rules per se. So I'd encourage you to kind of set your, sorry for the background noise, set your standard or expectation for what you expect the customer to do and what things that you're going to have some license on. And so, we politely remind, but there are those customers at times that, if they're going to make the choice to make your other customers unsafe, you're going to find that you're going to be tested on each of these things. And you're regularly going to be asked about the what and why. And so you do want to prepare all of your frontline associates how to answer those questions. I think I've met every member of the news in our stores over the last couple of months, wanting to get details on what we're doing and why and that sort of thing. So do expect a lot of questions from customers about the decisions they're making so that anyone on your team is prepared to speak to it. But those are some of the measures we've taken and some of the pushback that we saw as we rolled things out with Walmart.
Thanks, Clinton. You made a mention of 90% of the customers are pretty good about that. We had 88% voter participation, which I would say is a fantastic result on a poll compared to standard elections here. So what is interesting is on the call, 85% of you on the call agree that you would be willing to wear a face mask as part of reopening from a store perspective. And I can tell as a consumer who experienced this on Saturday with two similar retailers as far as what their products were and maybe less than 5 blocks apart from each other, I felt dramatically more comfortable wearing my mask in the store that had the mandate for their staff to be wearing it than I did in the store that did not. And so there is that consumer confidence part that we're going to have to exhibit as employers to be able to help keep this going in the right direction. Clinton, we did have one question directed to you here on with attendance issues and basing because of your more aggressive policy to be able to send anybody home that's not feeling well. How are you guys navigating that element? Looks like you're still on mute, Clinton.
That's cool. I got to practice around that way. No, I just back to Dave on that, but no, there's obviously been a huge amount of associates that have not come to work. Either they're not comfortable, they've exhibited a symptom, they don't want to wear the mask, and getting people paid and not having basically repercussions for attendance right now. Yeah, we've had huge portions. I mean, call out rate can be 8 to 10%, and that's a building with 300 to 500 people. So that's pretty incredible. Again, we're very fortunate for our size, but we have hired, probably close to 1,000 people across just my 10 stores in the area. And we've been hiring them on as temporary associates. A lot of the folks we've hired, we hired some the other day I talked to, he used to own a couple gyms in town and ran them, and they can't be open, and he just doesn't want to be bored and wants some income coming in. So we've hired a tremendous amount of temporary associates, and hiring them on as temporary, they know from the start that as things evolve, those positions may not exist forever, but it gives them work while we're going through this. And so we have had to hire a lot of people to offset that. But it is definitely an issue. I think that's going to be an issue for any businesses that reopens. There'll be people that don't want to come to work yet, whether the governor says it's okay or not. I have a store manager who runs a store. He works 6 days a week. And he has a son that pushes carts for us. And he told his son, I don't want you going to a store, stay home. And so he's not at work. And so, you know, even from that mindset, I think that that'll be a big challenge for anyone.
Gotcha. Thank you both, Clinton and Jeff, for the insight. I know that this is going to be an ongoing process as we get closer to the point of having additional businesses be eligible to reopen here. And so obviously planning ahead and taking that feedback that you both have learned through trial and error, as well as the other businesses that are able to be open. And that balance of having associates embrace the necessary precautions to help the consumers also join us in that, to be able to safely stay open once we're given the green light, is going to be key. I know that was something you both referenced. So thank you again for joining us today. At this time, we do have Kara Kuhn from GSI on the line, and I want to give her a minute to run through just an update on where we're at on the recovery framework that the chambers are all working towards and putting into place. So Kara, looks like you're joining us from the ECC. Good morning, and we'll turn it over to you.
Thank you, everyone. Hopefully you can hear me. We're actually at the office 6 feet apart. Alicia and I are here today. And I just wanted to provide a really quick update, really augmenting what Tommy Gantz was able to talk about. And thank you to Jeff and Clinton, lots of great information there. In 3 areas that we are focused on and working on right now. The first being, we are connected, and GSI, we have sent an email to all of our local manufacturers and to be included in the tool that Tommy was talking about for AWB, and have reached out to other partners, Lance included, to send out to their manufacturing channels so that we can get our East Side manufacturers and our Spokane region manufacturers into that process, which I think is excellent. So it's a little bit two-pronged, so we're doing that. We're also really looking long-term in what would our manufacturers need, and what are their capabilities now to actually secure and build our own local supply chain here, knowing that this is really a longer term issue than just a couple months. And so we're really looking to build up and stand up a streamlined supply chain here locally in our region. We are working, GSI has been building a website. We've had a lot of resources, assistance, and relief over the last, I call this week 10. So over the last 10 weeks, we've built a lot of resources to links and everything like that for the assistance and relief and resources. What we are building now, and we should have a great draft live tomorrow afternoon, is really this next phase for our community. These are different than the governor's phases, so I don't want to confuse people, but we're moving really into the recovery and reopening phase. And so what do our business community, what are the needs? And we heard a lot about that today. PPE is top and center on everybody's list of what we need to do to get back to business. So we will be linking to the AWB marketplace from that site, from our site as well. And the other pieces that we'll be putting up there are links to, as we go through the phases at the state, what are those requirements by sector, and we'll have links to all of those immediately as they come out. I have an employee that will be looking at those daily and really being able to, because we've all heard from a lot of businesses, you know, that they need the guidelines. What are those specific things we're going to be asked to do when we open? And so we'll be a great source for that information as well. So we'll be building that out. And we will also be utilizing the AWB Small Business Toolkit when that is completed. We'll have a link to that on our page as well. So we've always been good partners with AWB, and it extends to this time as well. Last and definitely not least, all this talk about masks and all of those things is so important and just leads to the overall regional marketing effort that will be underway. And I know it's kind of hard to think about a marketing effort. This is really a kind of a social norming campaign that we will be really working right alongside Lance and Visit Spokane, our other regional partner, in addition to really reaching out, and we've met a few times with localized business development organizations like Downtown Spokane Partnership, INBA, SIMBA, those types of organizations too, that will provide a localized marketing campaign, hopefully related to the overall arching campaign. So there will be a lot of kind of outward norming, meaning it's really looking at the expectations of what our future reopening looks like, and how us as customers and us as employees and business owners, how are we moving into these next phases? There will be different things that go on. People will be wearing masks more, I hope. But what does that look like? And how do we prepare both our employees and our customers for what they can expect at our locations when they come into them? And knowing that really what we're looking for is employer confidence to open, worker confidence to go back to work, and consumer confidence to purchase and buy. So those are really our guiding principles and what we're looking to do with this overarching regional campaign, but more to come on that in the next few weeks.
Okay, thank you, Alicia. And I know one question from Dave Kavanaugh there on, will we be facilitating this in an industry-focused aspect as well? And I know that is definitely, there will be an industry-focused element to this. The toolkit, there's an overarching toolkit, but we do understand that different businesses will have different needs based on what their facility setup and whatnot is and how that varies in their customer interaction. And so as part of matching and meeting the terms of the governor's reopening, we do acknowledge that there'll be certain specific areas that need their own work streams. And so those are wrapped under the overall effort, but where we can streamline and centralize, we will, and where we need to break out, we certainly will provide that forum for it. So thank you for that question. One final note before we let you off the hook here. We do have an effort underway that stemmed out of the Business Recovery Work Group that actually took on the Class of 2020 recognition. And so you will see information coming in the next week from this work group. We're working on a way that business can participate in the effort to recognize those seniors in our community. We are making this a region-wide effort, and so just be on the lookout. We've got everything from certain areas in public spaces that provide an opportunity for social distancing and gathering to have some murals put up here very soon for seniors to be recognized. There's a local effort with the Great PNW, a local company here, to work on a branded campaign that will bring those students all together under one umbrella here and give them an opportunity to be celebrated. We know that was a huge miss for them to not be able to go through their standard graduation process here, and whether it's just delayed or forever canceled, those elements are being determined on a school by school basis. However, in the interim, we wanted to provide a forum for them to be recognized and for businesses to participate and recognize those seniors in their area. And so just again, be on the lookout. We'll have much more on that by next week's call as details are coming together here for that. There will be an area if you'd like to support that effort. There's some t-shirts that are being done to recognize the classes, and so offsetting the cost for students who might not be able to afford those t-shirts. We've been able to print those at cost essentially to provide kind of that unified voice for these students. And so that's just one of those elements. But again, we'll have a simple ask if you're able to participate. If you have a school you'd like to support, we'll be able to connect you in a way with those specific schools to recognize those seniors in your area. I know one of the early efforts has been the yard sign, so you see those all over town. We have several of our smaller printing companies here locally that are willing to print those. So any questions on that project, feel free to reach out to us. Again, I'll have Colin put the email address info@SpokaneValleyChamber.org in there. Our foundation at Spokane Valley Chamber Foundation is going to be the recipient of funds to then distribute them back out to the schools for the support. So that'll be another element to where if you have the capacity and you have the capability and you like the cause, we'd invite you to participate on that end. And there's a good mix of ways to participate, both financially and just by in kind. So we look forward to seeing you involved in that effort to not miss this opportunity to recognize those students in our area. So again, on behalf of our speakers, thank you for joining us today. Dr. Lutz, Tommy Gantz from AWB, Jeff Phillips from Rosauers, Clinton Slovarp from Walmart, and then Kara and Alicia from GSI. Again, thank you on behalf of the chambers for joining us. We look forward to bringing you another call next Thursday. Again, you will receive an invite for the call for manufacturing focus that will be available on Tuesday at 11 to noon next week. This call is recorded. We will have it posted later this afternoon. We'll send out a full recap of the Q&A that was hosted, as well as the link to the video, and you'll be able to follow up there. So should you have not got your question answered for any reason, let us know and we'll make sure we follow up directly with you. And thank you for joining us. We are adjourned.
Thanks, Lance.